Hi everyone, welcome back. My name is Hina Mazarudin and I am your Vice President for PAs in Virtual Medicine and Telemedicine. Today I'd like to continue a series that mirrors and complements our educational webinars that we do for our PA students so that we can share and shed some light on real-life examples of how PAs utilize telemedicine in their respective fields. I'd also like to use this opportunity to highlight our amazing members and to serve as an introduction or a networking opportunity so that we can build and connect together. You know that I believe we are stronger together. So without further ado, let's get started. Everyone, welcome back. Today I have another amazing PA who is practicing telemedicine as a provider and also has an interesting leadership role, and I want to introduce you to her. Her name is Sara. Hi, Sara. How are you?
Hi.
Welcome. Sara, can you tell us your name, how long you've been a PA for, and what area of medicine that you practice in, please?
My name is Sara Gallo. I have been a primary care PA for 10 years. I am currently working as a primary care PA in telemedicine and also doing digital health.
Thank you so much. And can you tell us a little bit more about your experience with telemedicine in the clinic and then especially about your leadership roles of what you do, please?
Yeah, I think where I started was actually, when the pandemic hit, I was working in a brick and mortar practice that I had been at for the last 5 years, and we were not seeing patients in the office because they weren't coming in. So I joined PAVMT and learned a lot and felt extremely empowered to reach out to my practice and implement telemedicine, for the short term for sure. And so I actually helped them develop their telemedicine program that they do now, including, billing and coming up with the workflows and figuring out the technology, and did that for the pandemic, and then ended up actually leaving to go into more of a telemedicine advocacy role at a nonprofit as a program manager, and taught telemedicine implementation to practices, especially within the safety net. And now I work for a telemedicine practice that doesn't have a brick and mortar. And we are doing telemedicine mainly focused around meeting the safety net, which is like Medicaid and uninsured, low income. So, yeah. And then for them, I'm doing more business strategy and trying to increase their reach. So a little bit about that. So we actually created a hardware item that you can take a telemedicine visit into the field. So it's not like done on somebody's phone. It actually is where somebody who can facilitate the visit, so like an MA or just somebody who knows how to use this the hardware. It's a case, and then you just bring it to wherever they are. So one scenario that we have used it in is actually in the Colorado Coalition for the Homeless. We actually go on site and we'll do a facilitated visit where we can actually be able to listen to their heart, take a look in their ears and throat by having a device in the case that's like you can open up and do a visit, and they can do a telemedicine visit with a virtual provider. So we're doing that, but in general, we're just trying to meet patients where they are.
That's amazing, Sara. Thank you. And that's so amazing that you literally have made telemedicine portable and on the go now. And even to a population such as the homeless population, which obviously needs, proper medical care. And it's so nice that you are able to use such a tool to reach their patients in need. So that's fantastic. Thank you so much.
Yeah.
All right. Can you tell me what you like about telemedicine and what you find to be a challenge, please?
So what I love about telemedicine is it allows another type of channel for patients to be able to at least connect with their provider, access care, something that might be more designed for somebody's lifestyle. So the patients will surprise you, like, older patients are just as savvy sometimes, or more than younger population.
Absolutely. And what do you find to be a challenge?
So for a challenge, I would say implementing, I think the biggest thing would be concerning coming back from the pandemic. So I think as I kind of imagine how as like in-person visits are going to be in demand again, how are practices going to be able to build a hybrid model where they can still offer telemedicine to their patients that want it, but still, like, you know, not let in-person visits take priority. So
Yeah, absolutely. And it's a good thing that, like, you share that you have that experience with implementation and how that flow will be much smoother so that when we do go back to post-pandemic world and things are back to our new state of normal, how we're able to integrate both, you know, in-person visits and, of course, telemedicine, because they both have their value. It's just a matter of creating that environment and that cohesive environment where they can kind of blend together and have that great experience for both in-person as well as virtual.
yeah, I mean, I think it should be part of it. You know, I think it's really good to have, if you don't have like a regular PCP, to have your telemedicine practice, or if that's where your provider is and they're just virtual, that's fine. But also, I think a lot of people are hoping to keep the continuity, but not have to always come in for, you know, certain follow-ups. And I think it's totally appropriate.
Can you share with our PA students and our fellow PAs a clinical pearl, please, or some kind of tidbit or piece of advice?
So I think like the one thing that I probably didn't talk about yet is getting into non-traditional roles as a clinical provider and using that the experience that you have to really also translate into other opportunities to make impact just as much as you would as a clinical provider, touching people or seeing people and giving advice to like the individual person. So I am you know, I do some clinical telemedicine, but I actually do mostly digital health product strategy, product design, and also kind of just like business strategy to kind of design or improve the technology and the innovation space in healthcare. So, you know, currently, you know, I'm working on some initiatives that are involved in preventative care and reaching patients outside of the office, and trying to elicit, you know, some kind of action to, you know, do something for their health or do screenings or something like that. But there is a huge need for clinicians once you get your, you know, your stuff under your belt. But if you really feel like there's a different calling, like you're heading more towards like a, like, you know, you think administration or something, but the startup world, the tech, the digital health world needs clinicians. And your understanding of patients and providers and the entire medical staff that you work with, understanding the behaviors, the incentives, and just the mindset is super important to have at a leadership level in these, you know, innovation spaces. So I highly encourage, if you're really interested in like all the pieces of the pie, health systems, you know, workflows, implementing new innovation, that there is opportunities for you outside the clinical space that you can take all of the experience and all the great things that you got to do as a PA, like traditionally, but then be the leader to make products that your colleagues and your patients will absolutely benefit from on a much larger level. So I definitely think that was something that I didn't think about until, you know, I had gone into a startup by accident and found like some real inspiration in making, like, reimagining the healthcare system.
That's amazing. Thank you so much for sharing that with us, Sarah. And thanks everyone for tuning in. Have a great day. Bye.